Iloperidone Complete Drug Monograph. 1. Generic name, drug class, brand name, drug forms. Generic name, Iloperidone, brand name, Fanapt, worldwide brand. Drug class, atypical, second-generation antipsychotic. Drug forms, oral tablets, 1 mg, 2 mg, 4 mg, 6 mg, 8 mg, 10 mg, 12 mg. Tenor 2. Definition. Iloperidone is an oral atypical antipsychotic that works by altering the activity of neurotransmitters in the brain, particularly dopamine and serotonin. It is approved for the treatment of schizophrenia in adults. 3. Mechanism of action. D2, dopamine type 2 receptor antagonist, reduces positive symptoms of schizophrenia, hallucinations, delusions. 5-HT2A serotonin receptor antagonist, improves negative symptoms, apathy, withdrawal, and cognition. AT1 adrenergic blockade causes orthostatic hypotension, drop in BP when standing. Moderate affinity for histamine H1 receptor, mild sedation and weight gain. Negligible affinity for muscarinic receptors, low risk of anticholinergic side effects, dry mouth, constipation, urinary retention. Number 4, uses. FDA-approved use, treatment of schizophrenia, acute and maintenance therapy in adults. Off-label uses, limited evidence, bipolar disorder, aggression or behavioral disturbances not commonly preferred. 5. Indication, primary indication schizophrenia, not recommended, dementia-related psychosis, increased mortality risk. 6. Contraindications, absolute, known hypersensitivity to iloperidone or any component of the formulation. Relative, caution required, cardiac conditions, QT prolongation, arrhythmias, recent MI, uncompensated heart failure. Severe hepatic impairment, concomitant use with strong CYP2D6 or CY3A4 inhibitors without dose adjustment. Hypokalemia or hypomagnesemia, increase arrhythmia risk. Number 7. Before taking this medicine, precautions. Cardiac risks. ECG recommended in patients with arrhythmia, QT prolongation, or family history of sudden cardiac death. Orthostatic hypotension risk. Avoid rapid dose escalation. Seizure risk. Use caution in patients with seizure history, metabolic syndrome. Monitor blood glucose, cholesterol, and weight. Dementia-related psychosis in elderly. Increased risk of death, boxed warning. Pregnancy, category C, risk cannot be ruled out. Breastfeeding, unknown if excreted in breast milk. Number 8, how to use. Take by mouth, with or without food. Must be titrated slowly to avoid hypotension. Should be taken at the same times each day. Do not crush or chew tablets. Number 9, dosing information. Adult schizophrenia, start 1 mg twice daily. Increase gradually over 4 to 7 days. Day 1, 1 mg BAID 2. Day 2, milligram BAID. Day 3, 4 mg BAID. 6 1. Day 5, 8 mg BAID. Target dose, 6 to 12 mg BAID, 12 to 24 mg total. Max dose, 24 mg per day. Dose adjustments. With strong CYP2D6 or C3A4 inhibitors, reduce dose by half. With C3A4 inducers, may need higher dose. Nastrabert 10. Missed dose, overdose. Missed dose, if 12 hours, take when remembered. If 12 hours, skip and take next dose at regular time. Do not double dose. Overdose symptoms, severe hypotension, QT prolongation, irregular heartbeat. CNS depression, somnolence, seizures. Management, supportive care, monitor ECG, fluids for hypotension. 11. Stop or avoid taking. Do not stop suddenly, may cause relapse or withdrawal symptoms, insomnia, nausea, rebound psychosis. Avoid with alcohol, increases sedation, risk of fainting. QT prolonging drugs, risk of arrhythmia. Grapefruit juice, CYP3A4 inhibitor, drug levels. Number 12, side effects, common 10%, dizziness, drowsiness, dry mouth, nasal congestion, weight gain, increased appetite, orthostatic hypotension, fatigue. Less common but serious, QT prolongation, risk of sudden cardiac death, neuroleptic malignant syndrome, NMS, fever, rigidity, altered mental status, tardive dyskinesia, TD, involuntary repetitive movements, seizures, increased prolactin, menstrual irregularities, galactorrhea, gynecomastia, agranulocytosis, rare, risk of infection. Number 13, vital information. Boxed warning, not approved for elderly patients with dementia-related psychosis, risk of death. Requires slow titration due to orthostatic hypotension. QT prolongation risk, baseline ECG may be required. Monitor, weight, BMI, blood glucose, lipid panel, blood pressure, signs of movement disorders. Number 14, drug interactions, CYP6 inhibitors, iloperidone levels, fluoxetine, paroxetine, quinidine. CYP3A4 inhibitors levels, ketoconazole, clarithromycin, itraconazole, ritonavir. CYP3A4 inducers levels, carbamazepine, rifampin, phenytoin. QT prolonging drugs, amiodarone, sotalol, ziprasidone, haloperidol, erythromycin, methadone. Antihypertensives, additive hypotension. CNS depressants, alcohol, benzodiazepines, opioids, additive sedation. Thank you. Have a nice day.